In 1948 in Montreal, the legendary Dr. Roy Swank began testing a low-saturated fat diet to treat multiple sclerosis, and 50 years later, he was able to track down 15 of his former patients, and 13 out of 15 were walking, independent in their activities, and appeared youthful and vibrant. And today, we're going to discuss the theoretical basis of the Swank diet, the details of the diet, and the results of Swank's research, along with my critiques, and I have some timestamps if you want to skip ahead, and references below. Let's have some fun. Full disclosure, I do have a relationship with Professor George Jelinek, the author of Overcoming Multiple Sclerosis, which does recommend a low-saturated fat diet, though is different from the Swank diet, and it is not a financial relationship, and I'll reveal the details at a later time. By the way, my name is Brandon Beaber, and I make videos about MS every Wednesday, so please subscribe and ring that bell for notifications, and if you appreciate the video, please click like. We'll start with epidemiology. This is a map of saturated fat intake as a percentage of total calories in different countries. And you can see in green the countries that have low saturated fat or animal fat intake, and in red the countries that have higher saturated fat intake. And take in this map for a moment and look how similar it is to this map of multiple sclerosis prevalence. The idea here is that the rate of MS varies tremendously in different countries throughout the world. For instance, in the United States, the rate of MS is about 1 in 350 compared to only 1 in 25,000 in Cuenca, Ecuador. Now, of course, there are other confounding factors here, such as ultraviolet radiation decreasing the prevalence of MS close to the equator, and I have a separate video on that, but there seems to be significant environmental risk factors important in the development of MS. Also, the increase in fat consumption over time seems to correlate with the increasing rate of MS in developing countries. For instance, European people in the 1500s or before had a relatively low fat consumption, estimated to consume only about 60 grams of fat per day. Now, this is just total fat, but it correlates with saturated fat intake. Whereas by 1909, this rose to 125 grams per day, and by 1948, 141 grams per day on average, and 150 grams per day in 1952. Now, Swank did a very famous study on the prevalence of MS in Norway, and the map is a little bit difficult to interpret, but basically what he found is in coastal areas where fishing was more common and there was less meat consumption, the rate of MS was low, whereas in the inland and mountainous areas where they ate more fatty meats such as beef, the rate of MS was high. Also, if you look at this epidemiologic study, there seems to be a correlation between fat intake in different countries and the rate of MS. So on the left, you see high prevalence countries that have a lot of MS, such as the United States and Canada. They had higher average daily fat intake, which again correlates with saturated fat intake. Whereas with lower prevalence countries, you can see they had lower fat intake on average. Now again, there are other confounders here. For instance, in Japan and China, people of Asian descent seem to have a lower risk of MS even if they live in countries like the United States, so part of this could be genetic, but overall the trend is very clear. Furthermore, although we think of multiple sclerosis as an autoimmune disease, sort of distinct from other Western diseases like diabetes and hypertension, it seems that there's a correlation between the rate of multiple sclerosis and other diseases from an epidemiologic standpoint. For instance, heart disease, this is a logarithmic regression curve looking at the rate of heart disease and multiple sclerosis in different countries and the fat calories as a percentage of total calories, and you can see they match up almost exactly. Countries that have a lot of heart disease, that have a lot of fat consumption, also have high rates of multiple sclerosis. When he saw this data, Swank hypothesized that people with MS could have an abnormal sensitivity to saturated fat, and because some relapses come on quite quickly and could even resemble a stroke, he thought that the disease could be vascular in etiology, and he thought that possibly animal fat could cause red blood cells to clump together, leading to occlusion of small capillaries, disturbing the blood-brain barrier and allowing the immune system to infiltrate. He also thought that chylomicra, which are these structures which normally contain lipids within the bloodstream, could, in a high saturated fat diet, deplete an unknown blood factor involved in prevention of red blood cell aggregation. And from his book, you can see this little diagram of red blood cells clumping together and blocking off the capillaries. And we do, in fact, know that in MS, the lesions form around the post-capillary venules. You can see the central venule in these lesions on 3 Tesla flare MRI in a 30-year-old woman with MS. And he was sure the disease must be environmental because it seems to come out of nowhere in otherwise healthy people. And this is a quote from his book where he says, "With few exceptions, multiple sclerosis patients before becoming disabled are active, energetic, and highly productive. Generally, they are intelligent and vital individuals. Physically, they are of average height and weight and athletic in build and inclination." I'll let you read the last sentence there. So Swank designed a diet which he recommended to all of his patients in Montreal starting in 1948 that is now known as the Swank diet, centered around low saturated fat. So you would avoid things like whole milk, butter, cheese, and meat, and you would limit saturated fat to only 15 grams per day, or 3 teaspoons. For the first year, you would be especially strict, eating no red meat whatsoever, including dark meat of chicken and turkey, lamb, organ meats, game, ham, and pork. After 1 year, you could eat these meats, but only in very limited amounts, only 3 ounces per week. However, you could eat lower fat meats, such as the white meat or breast meat of chicken and turkey with the skin removed. However, you would have to limit fatty fish, such as tuna, salmon, and trout, and sardines, but white fish and other low-fat fish were allowed in unlimited amounts. You would minimize dairy fat, so you could drink milk, but it would have to be non-fat or skim milk or low-fat cottage cheese, and 99% fat-free cheeses were allowed. Certain vegetables are actually high in saturated fat, so you would limit olives and avocado. You could eat eggs, but only 3 whole eggs per week, but an unlimited number of egg whites. Also, you would increase the polyunsaturated oils to sort of make up for the saturated fat reduction. And this wasn't thought to be critical to the diet, but Swank believed that people would be more compliant with the diet if they could consume higher amounts of oils. And it was recommended to consume at least 20 grams or 4 teaspoons of oils, but up to 50 grams per day. You would also avoid processed foods, hydrogenated or processed oils, and you would limit refined sugar. Alcohol was okay in moderation, and you would avoid certain plant foods that were high in saturated fat, such as chocolate, coconut oil, and palm oil. And you would limit salt and try to replace it more with seasoning, and you would take 1 teaspoon of cod liver oil per day, which is high in vitamin D, now known to be correlated with multiple sclerosis severity. That wasn't known in Swank's time, and it's unclear exactly why he recommended this. He also recommended some other things, such as getting adequate rest. He would tell his patients to rest in the middle of the day for 1 to 2 hours to minimize stress, and he also thought that psychological factors were important in prognosis, and he thought that it was good to be optimistic and to have a determined attitude. He wasn't necessarily against allopathic medicine, though there was very little that could be done medically for people with multiple sclerosis in the 1950s. During exacerbations, he recommended strict bed rest, and he would even sedate people with drugs such as phenobarbital and butalbital. Of course, these days, we wouldn't recommend strict bed rest. Also, to treat relapses, he would use plasma infusions, and he would give fresh frozen plasma, and he would also use it to prevent postpartum relapses after delivery of a baby, and a typical regimen would be 2 units of fresh frozen plasma or 1 unit of whole blood. Of course, in modern times, we would use steroids such as methylprednisolone or prednisone. Now, Swank's book contains tons of recipes to help make it easier to stick to the diet, and I'll show you a few as examples. Now, people often talk about the Swank diet as a plant-based diet, but I was kind of surprised to see how many animal products are in the recipes and how much just plain junk food, although in terms of the desserts, he really does recommend these in moderation. So this is quick baked fish, and you can see there fish fillets, a cup of skim milk, but no butter, just oil. And this is scalloped tuna, and you can see they do use 2 whole eggs, but no butter, just oil. And this is chocolate chiffon cake, and you can see there are a lot of unhealthy ingredients, such as sugar and white flour and 6 egg yolks. It's not exactly plant-based. Now, this is sort of what you could eat in a day on the Swank diet. This is just one example. So breakfast, breakfast. You could have pancakes, one poached egg, coffee or tea, skim milk as a snack, etc. And one thing to note is he really only counts the saturated fat in fatty meats, eggs, and fatty fish, and he really overlooks a lot of saturated fat. So when you think about 15 grams per day, that seems really, really strict, but probably his patients were consuming much, much more than that. And these are just some examples of overlooked saturated fat that I calculated. For instance, even skim milk contains some fat, and even leaner meats like chicken definitely contain saturated fat along with nuts, and all natural oils, even vegetable oils, do have saturated fat, and a significant amount if you consume a lot of it. And considering that the Swank diet isn't all that strict, the results of his studies are really remarkable. So it all starts in 1948 in Montreal, and he had 150 patients with relapsing remitting multiple sclerosis, and he recommended that all of them go on the low saturated fat diet. So this is not a randomized controlled trial. He really compared people to natural history studies, and he compared people who were more compliant with the diet to people who were less compliant with the diet, and he compared people who started the diet later to people who started the diet earlier. Now, almost immediately, he lost 6 of his patients, and he has no results on them, and as the years went on, he had less and less patients that he was able to track down, but it's pretty remarkable that he was able to get such good and prolonged data, considering this study started in the late 1940s. So at baseline, these patients had a pretty high rate of relapses, about 1 per year, which is more than you would see in modern randomized trials, and that's in the 3 years prior to the diet. And while on the diet, attacks gradually decreased to only 0.05 per year on average, so a 95% decline, and most of these attacks were relatively mild and of short duration with good recovery. Now, he also wanted to measure disability, and this is long before the days of EDSS, or Expanded Disability Status Scale, and so he came up with his own disability scale, which he called the Neurograde. And this is just a measure of disability in MS, so 0 was normal, 1 was normal function but an abnormal neurological exam, 2 was mildly impaired performance, 3 was severely impaired performance but still walking, 4 was using a wheelchair, 5 was confined to a bed or a chair, and 6 was deceased. And you can see this is the 16-year study of the Swank diet, and you can see on average the relapses were around 1 per year prior to starting the diet, and this dashed line is when the diet started, and they just plummet dramatically. It takes a while to get a full effect, but they end up at around 0.05 relapses per year on average, and it stays down for many, many years. And this is basically as effective as some of the stronger disease-modifying therapies. You're looking at data from the Topaz study. This is an open-label follow-up of patients who received Lemtrada for 2 years, and they followed them for 8 years, and you can see the relapse rates are very low. Now, of course, Lemtrada also has significant risks such as secondary autoimmune diseases and infections, and I have a separate video on that topic if you want to take a look. And as I said, Swank didn't really have a control group, but he compared his patients to other published natural history studies. For instance, he looked at mortality rate in comparison to a historical control group with the Mayo Clinic, and you can see in the dotted line, Swank's patients had much lower mortality, and he also compared them to several other natural history studies looking at survival percentages at 10, 15, 20, 25, 30, and 35 years, and you can see Swank patients in dark gray had much better survival rates at every time point. He then looked within his own patients to see what predicted who would respond best to the diet, and one of the biggest predictors was starting the diet early. So these lines are divided based on how early on in the course of the disease patients started the Swank diet. So the first dot here, which is 28 patients, are people who started within 1 year of symptom onset. And the next dot is 1 to 2 years, and then 3 years, and then people who started later on. And you can see for those who started within 1 year of disease onset, they did very well, and even after 15 years, they had an average neurograde of about 2 or less. But if you look at the people who started later, they did significantly worse in the long run. So starting early on the Swank diet was key. The other big factor was compliance with the diet. And this is a busy slide, but he divided the patients into two groups. People who were compliant with the diet, meaning they ate less than 20 grams of saturated fat per day. Normally, he recommended less than 15 grams, so these were people who were fairly compliant, and those are the top two lines. And then the bottom two lines are people who ate more than 20 grams of saturated fat per day. Now, he divided this further, so the dashed lines are people who started the diet within 3 years of symptom onset, and the solid lines are all of the patients. And he also shows the average saturated fat intake, so 17 grams per day on average versus 38 grams per day. And at the very end, you can see the overall mortality rate, and on the y-axis is the level of disability, or the neurograde. So if you look at people who started early and were compliant with the diet, even after 35 years, they had relatively low disability, an average neurograde of around 2, and only a 21% mortality rate. But if you look at people who maybe started the diet later and were less compliant, they had an average neurograde of 5 with an 80% mortality rate over 35 years. So these are enormous differences despite relatively low differences in saturated fat intake. But despite all this data, I do have my fair share of skepticism, and I'm not the only one. Cochrane's evidence-based reviews commented that they couldn't really say whether Swank's diet works or not because his research methodology was just so bad. Not only were his studies not randomized and had no control group, he didn't really follow his patients very closely. He wasn't even in the same country for the overwhelming majority of the length of the study. Now, I have a few specific critiques. The first one you may think is a little bit of a low blow, and I'll explain more on the next slide. I really suspect the diagnosis of multiple sclerosis may have been wrong in many of his patients. Again, I'll explain more in a moment. Also, there's a bias in whether or not people stick to the diet based on how they're doing. Some people who had milder MS may have been doing better and may have been more confident in the diet and more likely to stick to it long term, and Swank does acknowledge this in his book. Also, it's really difficult for me to believe that people were so compliant with the diet over so many decades, even if they weren't receiving direct guidance, even when a diet is 100% effective, such as in controlling weight and diabetes, people often deviate from it just because maintaining a specific diet is pretty difficult for humans to do, and unfortunately, most people have trouble achieving it over the long run. The other problem is he didn't calculate saturated fat correctly. There's a lot of missing saturated fat, and as I said, people in his studies were probably consuming a lot more saturated fat than he or they believed. And also, it's really difficult for me to believe that there were such spectacularly large differences in outcomes despite relatively small differences in saturated fat consumption. To give one example, in one of his studies, the subgroup of people who had significant disability upon entry, in other words, they had neurograde 3 to 5, they had 0% mortality, 0 out of 22 died, and they had an average saturated fat consumption of 21 grams per day. But in a group of people who had an average saturated fat consumption of 29 grams per day, they had 91% mortality. So an 8-gram difference in saturated fat per day could create such a large difference in mortality, it's almost impossible. Even reporting error and biases and people remembering what food they ate should blur the data at least a little bit. It's just too difficult for me to believe. This just doesn't really happen in nutrition science. There can't be a magical cutoff at 20 grams of saturated fat intake per day. Now, in going back to the misdiagnosis problem, this is a section from his book, a quote where he talks about diagnosis of MS, and he says, "The recently introduced nuclear magnetic resonance scan, NMR or MRI technique identifies much smaller lesions," he's comparing it to CT scans, "and shows promise of superior performance. However, at our experience at present is insufficient to establish this, and in a number of early cases, the test has failed to be confirmatory." Now, this is a huge red flag because we now know that almost everyone with MS has lesions that are typical of multiple sclerosis on conventional MRI of the brain, and this was definitely true in 1980 when MRI first came out, and it's really a red flag to have no typical brain lesions of multiple sclerosis, and we know these lesions are almost always present even before symptom onset. In another place in the same chapter, he talks about how Spinal Tap fails to be confirmatory in about half of cases, but we know that about 90% of people with multiple sclerosis should have unique oligoclonal bands that are in the cerebral spinal fluid but not in the serum. Again, those two things, normal MRI and normal Spinal Tap, are huge red flags and signal possible misdiagnosis, which I'm not criticizing. Swank was very easy to do in the 1950s and 1960s, and especially the 1940s, and I do have a dedicated video on MS misdiagnosis if you want to take a look. Now, that all being said, I do find some of the epidemiologic evidence regarding saturated fat to be somewhat convincing, and even though his studies don't have great methodology, they are somewhat promising. So I personally do recommend a low saturated fat diet just because it seems to be generally healthy, and there's some evidence that it could be beneficial in multiple sclerosis, and of course the risk is very low. But I'd love to know your thoughts. Do you think low saturated fat is beneficial for multiple sclerosis? Have you tried the Swank diet or a similar diet or OMS? And what are your results? And you can post in the comments below and let me know if you have any suggestions for future videos.